Hello, hello, hello. Happy Saturday, everyone. Hope everyone's having a wonderful day. All right. Well, for those in the United States, it's Memorial Day weekend. So I don't know how many people will show up, but I figured I'd do a Q&A and I have an announcement to make. So that's also why I'm doing this questions answered session, this Q&A session. Session. So yeah, look forward to hopefully answering some questions. Just for those who are not familiar with me, I just want to let you know about some resources. So I have a podcast called Save My Thyroid. You can check it out by visiting SaveMyThyroid.com. And so a little bit more focus on hyperthyroidism, but I'd say like 80% of the episodes will benefit those with hyperthyroidism or Hashimoto's. And I also have a website, well, a couple of websites. So SaveMyThyroid.com is that was released in 2021, so just under 4 years ago. That's where you could find the podcast. But Natural Endocrine Solutions has been around now for 15 years, and that's, if you visit that, you could find hundreds of articles and blog posts related to thyroid and autoimmune thyroid conditions. I have a supplement line, which you can check out by visiting thyroidsave.com. I have a newsletter that relatively new, came out in January of this year, Healthy Gut, Healthy Thyroid, which you could check out by visiting savemythyroid.com/newsletter. And then I have 3 thyroid-related books: Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, and it is in its 3rd edition, which came out in 2023. Hashimoto's Triggers, hard to believe, but a little over 7 years now that came out. And the Hyperthyroid Healing Diet is my most recent book, and that came out last spring of 2024. And then my YouTube channel, my quiz, which yeah. So, and then as far as the announcement goes, so I am having a free 5-day accelerated thyroid healing challenge, which I've done in the past. This is the first time that I'll be doing this since January 2024, so about a year and a half. And starts Monday, June 2nd. So a week from this coming Monday. Will include 5 daily recorded lessons, live calls Monday through Thursday, 2 Q&A calls on that Friday, a daily assignment, engagement with others, prizes for participation. So I do a few of these every year, and they're a lot of fun. I have different topics, so this will be the only time in all likelihood that I present this topic. But and then there is an optional VIP upgrade. I've mentioned this because when you sign up, after you sign up for the free challenge, it takes you to a page where it gives you an option for the VIP upgrade. And every now and then there'll be someone who gets confused and think that it's not free, the challenge, because the VIP upgrade is not free. But again, the challenge is free. The VIP upgrade allows you to have access the recordings, like long-term, as well as like the PowerPoints and the transcripts and a few other bonuses at a reasonable cost. And then to register, you can visit savemythyroid.com/thyroid healing 2025. That's for the free challenge. And that is it. If there are questions, I would be happy to answer. If there are not questions, that's okay too. Again, don't know what to expect, being that this is a holiday weekend. But just like I said, wanted to make an announcement. Usually do these on Fridays, and just yesterday was busy. Had a number of podcast episodes and a lab test. Had to have a call with the lab about a patient's test results. Just so really didn't have a whole lot of time to do this yesterday. Figured I would pop in on Saturday and again see if there's, besides making an announcement, just give the opportunity if there are questions. Since I did one last week, I did actually a few of the, I did a Facebook Live. Well, again, not Facebook Live. I keep on saying Facebook Live, but this now it's on Facebook, but also YouTube. And I did one of these last Friday, and then last Saturday I did like a Zoom call talk about natural hyperthyroid symptom management. So I've answered a lot of questions, and then 5 day accelerated thyroid healing challenge. There'll be plenty of opportunity to ask questions. So Mama Boys says my TSH is 0.006. Is this mild hyperthyroidism? I mean, the TSH really doesn't determine the how severe, like the severity of the hyperthyroidism. It's more the thyroid hormones. So if your TSH is 0.006, but your thyroid hormone levels are looking good, then yes, I mean it's you could say mild hyperthyroidism, but it would be like subclinical hyperthyroidism. Oh, actually, here we go. Um, yeah, so free T3 1.38, total T3 kind of on the higher side within a range. So yeah, I mean it's more subclinical. So you could say mild hyperthyroidism, but it's really uh, called subclinical hyperthyroidism when you have a low TSH and the thyroid hormone levels are within range. And I mean yeah, some people do have subclinical Graves' disease. You might have already had the antibodies, and a lot of people they're negative with subclinical hyperthyroidism, but just keep that in mind too. If you haven't had the antibodies for Graves tested, the thyroid stimulating immunoglobulins, and well, that's the main one, which is a type of TSH receptor antibody. So some will test the TRAb, but the TSI or thyroid stimulating immunoglobulins is the more specific antibody associated with this. So yeah, with looking at again subclinical hyperthyroidism. Any other questions? What other questions do people have? Let me take a quick sip of water here. Yeah, so for those who trickle in late, again, the slide you see is for my upcoming free 5 day accelerated thyroid healing challenge starting a week from this Monday. And yeah, and that's the website, savemythyroid.com/thyroid healing 2025 in order to register. And yeah, usually when we do this, we usually get a few hundred people registering, anywhere from like 300 to 500 people. Sometimes we get more, but again, we'll see. It's also last time I did it was the beginning of the year, January 2024. Now June is again a lot of people start traveling, so I guess we'll see. But I still imagine there'll be a few hundred people, maybe closer to 300 than 500. But I don't know. We'll see. So we'll find out soon enough. But okay, are headaches a simple symptom of hyperthyroidism? Usually not. Most people with hyperthyroidism don't have headaches. I mean, every now and then I mean, you could have, of course, headaches that are not related, but sometimes every now and then someone will have a tension headache that seems to be related to like the hyperthyroidism, or like they didn't have headaches prior to the hyperthyroidism diagnosis, but then once they got diagnosed, they get headaches every now and then. So it's possible. It's not a common symptom associated with hyperthyroidism. Yeah, you are welcome. I think I'm pretty sure you are on last week when I did it on last Friday as well. And yeah, always enjoy answering questions, and just yeah, that's figure again. I couldn't do it yesterday, so I'm doing it Saturday, and was curious to see who would show up since it's Memorial Day weekend. But like I said, I just didn't have a chance to go yesterday. All right. Hey, Karen. What level does the TSI have to decline to before one notices decline in free T3, T4? It really does vary depending on the person. I mean, as long as there's some level of antibodies, some thyroid stimulating immunoglobulins stimulating the TSH receptors, it is possible for the person to remain hyper. I mean, the truth is everybody's different, and sometimes we do see as the TSI decrease, the T3, T4 decrease, but then in other people we'll see where it just doesn't budge. until the TSI is either within range or like almost like within range. And I wish I knew why that was the case. That's one of the many complexities of the body. Because in a perfect world, we'd want to see TSI and everybody decrease and thyroid hormone levels decrease, but that doesn't, unfortunately, that doesn't happen with everybody. And like I said, I mean, there are people where their TSI is just mildly elevated, like just above the reference range, and they're still hyper, and they stay hyper until that drops below the reference range. And yeah, so, and sometimes it'll take time, even when it's below the reference range. It might not be like right away, like it's not 6 months later, but sometimes usually we'll start seeing a decrease, but it's not like someone has a TSI that's elevated and they're hyper, and then let's say the next time they test and TSI is looking good and the thyroid hormone levels are normal. A lot of times what'll happen is that in that case we'll start seeing significant improvements with the thyroid hormones, but again, even that will take time. But like I said, in that case, usually it's not like 5 6 months. Usually it's a relatively quick process, but it might not be reflective on the next blood test. Yes, exactly. Yeah, yeah. I mean, Graves and Hashimoto's are definitely. I mean, all autoimmune conditions are complex. But I mean, some are more complex than others. Like some situations are more complex than others. And yeah, so are headaches a symptom of hypo? So we had that question about hyperthyroidism. My daughter is 18 and has subclinical hypothyroidism. Again, just like the case with hyperthyroidism, not really. I wrote in my Healthy Gut, Healthy Thyroid newsletter, I forgot what edition, but I did talk a little bit about headaches, and in the literature, I can't say there's a lot of research showing relationship between thyroid imbalances and headaches. There's some, but all I could say is from like working with people with both hyperthyroidism and Hashimoto's over the years, or hypothyroidism, low thyroid hormone, high thyroid hormone. Again, most people don't have headaches. There's always going to be exceptions, and sometimes it might, again, sometimes it's not going to necessarily be related to the thyroid, but if someone never had headaches and then all of a sudden they developed headaches at the same time, again, still could be a coincidence, but maybe it is related to the thyroid hormone imbalance. But most of the time, that's not the case. All right, Karen, you are welcome. Okay, so I have one large goiter, and my endocrinologist wants to remove the entire thyroid because I have Graves. I only want the goiter removed and not the entire thyroid. When I go to a surgeon, what do I tell them? So a goiter is an enlarged thyroid. So I'm not sure if, do you mean nodule, like thyroid nodules? Um, and then, like, the next question, will a surgeon be willing to remove only the goiter? So again, the goiter is like a goiter is relates to the enlargement of the thyroid gland. So if someone has like a really large goiter, um, again, there are ways to shrink it. And again, that if it's really large, it might not go back to its original size. I had a mild goiter when I dealt with Graves, and I was able to normalize it. But if it's really like, if it looks like the person swallowed a tennis ball, again, I'm not saying we can't decrease it at all, but it depends as far as how much we could decrease it. Depends on the person. So nodules, thyroid nodules, even nodules, usually they won't remove nodules individually, but there is like what's called radio frequency ablation that specifically removes nodules. So for goiter, again, goiter is related to the thyroid. So yeah, okay, it looks like nodule here. So, and then, yeah, endocrinologist believes the only way to remove Graves by cutting out the entire thyroid. I showed her your book and she wasn't impressed. Yeah, not a surprise. Most of them aren't impressed by my book. Uh, you know, again, it makes sense. It's more of an immune system condition, So why don't you do things to address the cause of the problem? And they'll say, well, you can't do anything to address the cause of the problem. Does diet help? No, diet doesn't help. It's just, yeah, the only thing that helps is radioactive iodine, surgery, or maybe taking anti-thyroid medication, according to them. So yeah, it's I've been doing this now over 15 years. I've had so many patients have show endocrinologist my book. You mentioned nodule before. So yeah, that, like I said, nodule, the surgeon will not remove a specific nodule in most cases, but I mean, there are ways to shrink nodules. It just takes time. And I mean, it's not always effective, like addressing the cause of the nodule. And the only way to know is by doing a follow-up ultrasound. But I've, I've seen patients over the years with nodules decrease and normalize. And then I've also seen some where they don't decrease and normalize. Most of the time they're benign, but if they are larger, again, addressing the cause of the problem is still, I think, a good idea. But there's radio frequency ablation, which is not radioactive iodine. Radio frequency ablation is just targeting the specific thyroid nodule. Again, if you go on my podcast, savemythyroid.com, and type in radio frequency ablation, or Dr. Angela Mazza, Mazza, is an integrative endocrinologist that was on my podcast, and she spoke about RFA. She's like if I had to get RFA, radio frequency ablation, I probably would have her do it. All right, let's all right. So just to understand that TSI should decline, I was told, but it was for Hashimoto's, antibodies will go down, but it will always be present. I was diagnosed with Hashimoto's first, but I will also have TSI of 5.37. Yeah, I mean, the goal is to see it decrease and eventually normalize. Most endocrinologists aren't going to do anything to address the immune system component. And so you usually won't see it normalize. You won't see the antibodies normalize. And uh, for those working with endocrinologists, because they're just giving anti-thyroid medication, or again, radioactive iodine thyroid surgery. But yes, and I on my podcast, I just late 2024 into early 2025, so not too long ago, I had a 6-part series on lowering antibodies. So which again, completely free. So feel free to check that out on the podcast. Yeah, 5 centimeters. That's a pretty large nodule. So maybe, yeah, you might want to look into radio frequency ablation. Again, it'll take quite some time if the nodule does decrease through a natural approach. Yeah, because like 1 to 2 centimeters, even 3 centimeters, 5 centimeters is pretty big. So I'm not saying not to do things naturally, but you might want to listen to the interview I did with Dr. Angela Mazza. There are other practitioners, so you could always do a search. She's in Central Florida, but there are others throughout the United States and now even internationally. But you just need to do some searching. I don't think there's yet like a database, like a website that has all of them listed. So, what's your opinion on castor oil on the thyroid? So, I did interview an expert on this on the podcast. I mean, it's very popular. Castor oil packs, very popular, but um, yeah, I wouldn't expect any miracles. And then when I interviewed Dr. No, she's not a doctor. Carrie, her last name was Vitt, but then she changed it. I forgot her last name, but she was talking about how you want to support the liver first before putting it on the thyroid. So again, you might want to listen to the episode. If you visit savemythyroid.com and just type in castor oil packs or just castor oil, you should find the episode. CMOS, I mean, the concern with CMOS, depending on the person, is the iodine. So, yeah, I can't say I recommend CMOS to my patients, but every practitioner is different. So if you get 10 different practitioners, some will say yes to the CMOS, some will say yes to the castor oil, some will say no. I think castor oil is fine. Like I said, just keep your expectations in check. CMOS, I'd be a little bit more cautious about. John, you are very welcome. Thanks for your questions. And same CL, thank you as well. All right. Anything else? I think I've answered everything so far. Yeah, if there's no other questions, I could definitely call it a day. Again, realizing it's a holiday weekend, but yeah, I figured since I have my free 5-day challenge coming up, I'd hop on quickly and just spread the word. I'll also be sending out an email probably on Monday or maybe Tuesday. Usually it would be Monday. Probably might maybe still Monday, even though it's Memorial Day. We'll see. Okay, Joshua, why all my doctors never talk about TO, T1, T2, T5, T4? I mean, as far as like some of the different thyroid hormones, they don't talk about it because you can't measure them. You can't measure them. And then, I mean, if you take like desiccated thyroid, there it's going to be like you're not just going to get like T3, T4, you'll get like T1, T2, calcitonin in like desiccated thyroid. But again, you can't measure it. There are like T2 supplements now that some practitioners recommend. But yeah, most conventional doctors aren't going to bring it up at all, and they usually don't recommend desiccated thyroid like Armor or Nature Thyroid, thyroid glandulars that might have these. They're just going to usually recommend synthetic thyroid hormone like levothyroxine, with Synthroid being the most common brand that they recommend. What is the vibration feeling in my gut from? Is it thyroid or H. pylori? And probably not thyroid. I mean, I can't say that most people, at least most people, when I work with someone, and I've worked with a lot of people who have obviously thyroid conditions, but also H. pylori over the years. I can't say it's common to have vibration feeling with H. pylori, but I would say it's out of the two, it's most likely related to that, unless if there's something else going on. Um, but even like things like parasites, I can't say most people like will say, "Hey, I have a vibration feeling." But yeah, I would imagine it's more related to the H. pylori. Also, vagus nerve. So vagus nerve, which is part of the parasympathetic nervous system. If you have like vagus nerve imbalance, that could be a factor, and stress will play a role in that. Um, Doing vagus nerve exercises like vigorous gargling, cold showers could potentially help. Okay, that's what I was thinking. Yeah, again, not thyroid. So yeah. So John asks, can Hashimoto's be triggered by mold exposure? If so, is the only way to reverse it to eliminate mold toxicity in my body? I'm taking 150 micrograms of levothyroxine daily and I've been for over 4 years, yeah, which is a pretty high dose. I mean, mold definitely could be a trigger. If it really is a trigger, like if it's really causing that response to go haywire, then yeah, I mean, you would want to eliminate the mold toxicity, like just taking supplements to, like, let's say, bind to the mycotoxins and to like excreting them is only going to help so much. I'm not saying it won't help at all, but you'd have to like continue to take them. And even then, I've had situations where I've worked with people where mold was an issue and they weren't able to address the source of the mold, either financially or again, the spouse wasn't on board. And yeah, so that and again, we've like supplements will help in that case to some extent, or sometimes they won't. It depends how bad, but sometimes they will help a good deal. But the thing is, the person got to will need to keep on taking them. And again, that still might be a cheaper option than remediating the house. And if someone's in an apartment, it might not be an option if the landlord's not going to remediate, and if they're stuck in a lease and they can't move. And I wouldn't remediate an apartment because it's not my place. So in that case, maybe someone might need to take supplements temporarily until they're in a situation where they could move. Or again, if they're owning a home and they can't remediate, um, then they might have to wait until they are financially able to afford that. But if the mold is the main trigger and they're not getting rid of the source of the mold, then yeah, then you're probably not going to be successful in reversing that autoimmune response. Not what a lot of people want to hear, because again, definitely could be expensive to remediate the mold. But yeah, I would definitely want to be upfront. Yep. Okay. Yeah. You are very welcome, John. Thanks for your question. Karen, you are very welcome. Thanks for popping in here. And thanks everybody for showing up. Again, wasn't sure what to expect on the holiday weekend. And like I said, the main reason normally I wouldn't do it on, I usually, I did one last week on Saturday for a different purpose, but usually I do it during the week. But yesterday was a little bit crazy, and then today, just I wanted to go live just to let people know about the 5-day challenge, which again I'll be sending emails as well. But figured I usually go on Facebook as well and YouTube. Oh, yeah, just they change over the years. I used to just stream to Facebook, so I always just call it Facebook Lives. But then Facebook changed our policy where you can't stream into the Facebook group. So then I'm like, well, why don't I just stream to YouTube and my Facebook page, which they allow, and still figure out the Instagram. I just started with Instagram last year, and it's a little bit more of a hassle to stream to Instagram. But yeah, but anyway, I'm glad we had some questions. Thank you so much for answering questions or just tuning in to listen to other people's questions. Again, there'll be opportunity to ask other questions with the challenge that will be taking place. Again, completely free, but just keep in mind once you register, there is a VIP upgrade option. So, but if you don't take that option, you'll still greatly benefit from the challenge. I recommend for everyone, whether you have hyperthyroidism, Graves' disease, hypothyroidism, Hashimoto's, definitely consider attending the free 5-day accelerated thyroid healing challenge by visiting savemythyroid.com/thyroid healing 2025. And if there are no other questions, I will call it a day and wish everybody, again, a happy Saturday, wonderful holiday weekend for those who are celebrating the holiday weekend, those in the United States. And again, hope to see some of you in a week and a half or a week from this Monday. So 9 days away until the challenge. So thank you so much, everyone. Again, take care and have a wonderful weekend.